Hi, my name is Stacey Mantich, and I am an LPN instructor at United Career Institute in Irwin. With me today, I have LPN students Rachel and Ranilyn Aquino, and they are going to be doing a dressing change on their patient. They're going to start with their patient care principles and then go into the dressing change.
Hi, my name is Ranilyn. This is Rachel. We're going to be doing your dressing today, okay? Can I have your name and date of birth?
My name is Helen Smith, and my date of birth is 1/2/72.
Okay, we're going to be rolling your left side. We're going to put the bed up and then put your head down a little bit.
Right now, they're repositioning the patient to make it easier for her to roll. They will begin by placing a disposable pad under the patient to prevent any soilage of the linens. And then they will remove the dressing by slowly removing the tape, making sure to not cause any tears to the tissue.
Let us know if you're in any pain.
Once the old dressing is removed, Rachel will clean the dressing with saline and 4x4s. Now that the dressing is clean, she will measure it for length, width, and depth. These findings will be documented in the chart. She will then moisten 4x4s. She will pull them apart to fluff them up. She'll then place them in the patient's wound. And cover it with another 4x4, as well as an ABD pad to prevent any leakage of any drainage from the wound. Prior to putting the last layer on the dressing, they will place the initials, the time and date of the person changing the dressing, and they will secure the dressing in place using tape. They will remove the linen saver pad and dispose of that, and roll the patient back onto her bed. They will assess the patient's comfort level.
Are you comfortable? Here's your call light if you need anything.
They will also make sure all of her personal belongings are within her reach. They will clean up their area and exit the room. Once they exit the room, they will perform hand hygiene.